Dr. Lee Angle here. Let's talk about a topic we all are somewhat at least familiar with and is fairly prevalent, is whiplash. Right now, that might be a car accident, it might be from a fall, it might be a sports injury, whatever it comes from. But let's talk about two things. Let's talk about what actually happens in a whiplash injury, and then what are the short and even the thing that I think is sometimes hidden, the long-term consequences of a whiplash. Right? So whiplash is pretty simply, right, that my head gets whipped back and forth, side to side, whatever direction it is, but there's a whipping motion. So when I get that whipping motion, you're putting tremendous amounts of stress on the soft tissue in the neck, right? The muscles, the ligaments, the tendons, and even the discs, right? A severe enough whiplash, you can have a bulging or herniated, protruding disc, and different video we can talk about the differences in those things. But a disc problem, you can tear muscles, you can tear ligaments, you can tear tendons, you can even tear, if it's severe enough, sometimes you can tear a piece of bone off, right, from a tendon. Now those are the more severe ones down through there, but car accidents, things, you get rear-ended at 50 miles an hour, all bets are off, we don't know what might happen. So when that happens, we injure that tissue, right? And over time, that tissue begins to heal up. But on average, the strength it had pre-whiplash and post-whiplash aren't necessarily the same. Now the muscles usually you can strengthen up. The ligaments and the tendons often aren't the same. So now we get a little bit of an unstableness in there. Not unstable, it's just falling all over the place. But maybe it's not as strong as it was. Or maybe the bones get locked in a bad position because everything is trying to hold that together. In a longer term sense, that's generally a lot where arthritis builds. Because I have an injury, I have a weakness, the body gets inflamed, it starts to lay down more calcium, and I start to build bone spurs, and I start to build arthritis, and that's where degeneration starts to come from. As far as the disc goes, it's a little bit of the same thing. A disc is fluid filled. That fluid is interchangeable at times. Stagnant water is always never good, right, in any kind of system. If that disc starts to lose fluid, and it gets fluid from the movement of the bone above and below, but if I've gotten locked down because I have an injury or I don't have proper motion, I don't exchange fluid, the disc starts to dry out a little bit. As it dries out, it weakens. As it weakens, that's when bulging disc or herniated or a reduction in the size of the disc, right? You hear degenerative disc disease. I don't really like the idea of calling it a disease. Now, I will say that genetically people can be more predisposed to how quickly that degeneration happens if there's a trauma backing it at the beginning. But in a perfectly healthy person that goes along, let's say somehow you magically have never had a trauma, you're not just going to spontaneously develop disc problems from some disease, right? It's much more a mechanism of time and a mechanism of injury over time. But that's why often I'll talk to people and they'll say, well, I'm having all these problems, but you had any traumas? Well, I mean, 35 years ago I fell off a roof, or 27 years ago I slipped on the ice. But that was a long time ago, Doc. What's that have to do with now? Well, it has everything to do with now if there was an injury in there. If that soft tissue was injured, if the bone was injured, if the disc was injured. And over time, an injury like that tends to, like I said, build more arthritis, get weaker, and it creates a problem in there. And untreated for 30 years, right, it's just going to get worse and worse and worse over time. That may cause nerve compression, it may cause artery or vein compression, whatever that is. But an untreated anything, right, over time, some things will resolve on their own. But a lot of times in the spine, if you don't return proper motion to it, then the disc weakens, the tissue around it can't mold itself back to what it should be, and then we start to develop problems over time. I mean, there's plenty of people that come in, or plenty of people you see that have a whiplash and instantly are very aware of it, right? There's a lot of neck pain, there's a lot of muscle spasm, maybe there's brain fog, there's dizziness, whatever it is. But many times people say to me, well, I had a car accident, it was no big deal, I didn't have to go to the emergency room. It doesn't require that. I mean, I'm glad you don't have to go to the emergency room. That doesn't mean there wasn't some measure of whiplash or some measure of injury in there just because they didn't put you in a collar, and helicopter you out of there and go to the ER. It doesn't have to be that dramatic for there to be a problem, right? If you get rear-ended at 20 miles an hour, that sounds pretty good compared to 50 miles an hour. But imagine if you're just standing there and somebody comes up and gives you a quick little push in the back, how your head is going to whip. That may be all it takes. Big heavy head on top of a little kind of spine, right? We've got a bowling ball and a stick. That thing whips around real hard. Sometimes damage happens and we don't think it was that big a deal because right at that moment we weren't carted off to the ER, or we didn't feel like we were acutely injured at that moment. That's why I always, if there's been some sort of trauma, and it's difficult to avoid, right? Coming out of the womb sometimes is tough, learning to walk. Kids start running, you ram your head into things or you fall. Sports, accidents, car accidents, anything over the years, it's real hard to not jostle somehow. And I think that's why people should be evaluated for that and find out if you don't have any problems, hallelujah, and let's move on. But if we do, we can find it, we can correct it, and start heading the other way rather than over time just going down, down, down.